Good afternoon. Welcome to the Superintendents Advisory Council, July 6th, 2020. I want to thank everyone for joining us. If you need to, we don't usually do a roll call. We use the participant feature on Microsoft Teams. When you scroll down with your mouse, if you hit on the little icon with the looks like people there, it will show the participants. But I am going to ask Karen Dodd we do have some new members joining the advisory council. Karen, can you introduce and welcome our new members?
I certainly can. All right. Actually, why don't we, Kevin, would you like them to bring themselves up on video so that everyone can see them as I call their names?
Sure, that'd be great.
Okay, so I will say the names, and then if you can bring yourself up, open up your video, say hello, and I'll let you say which district you're from. So let's start with returning members. Casey Allen.
Hey, this is Casey Allen from Ballard County.
Robin Cochran. Kate Dixon.
This is Kay Dixon. I'm not got a camera access today.
That's okay. Your district, please.
Barberville Independent.
Thank you. Scott Hawkins.
I'm here, Scott Hawkins, Woodford County.
Thank you. Mark Kopp.
Yes, Mark Kopp, Franklin County Schools.
Thank you. Mike LaFavors.
Yeah, Mike LaFavors, Boyle County.
Marty Polio. Matt Robbins.
Matt Robbins, Davis County.
David Rust.
David Rust, Campbell County.
Greg Schultz.
Greg Schultz, Oldham County.
Trey Settle.
Trey Settle, Callaway County.
Henry Webb. Okay, and now we will move on and welcome our new members, starting with Danny Adkins.
Danny Atkins, Boyd County Schools.
Deanna Ashby.
Deanna Ashby, Hopkins County Schools.
Doug Bennett. Tom Cochran.
It's Tom Cochran, Johnson County Schools.
Cornelius Faulkner. Sanford Holbrook.
Sanford Holbrook, Robertson County Schools.
Kyle Lively.
Kyle Lively, Somerset Independent Schools.
Danny Osborne.
Danny Osborne, Carroll County Schools.
Wayne Roberts.
Wayne Roberts, Wayne County Schools.
Jay Simmons.
Jay Simmons, Carlisle County Schools.
Rob Smith.
Good afternoon, Rob Smith, Bellevue Independent.
And Kelly Sprinkles.
Kelly Sprinkles, Knox County Schools.
All right. That's everyone, Commissioner.
Thank you. We have a great representation here and great attendance today, even though it's coming off a holiday weekend. I want to thank you for that. We have 3 items on our agenda, but I know better than to say it's going to be a quick meeting. I'm sure we'll take up our entire 2 hours. These are agenda items that I'm sure we'll have a lot of discussion, which is what we want. 3 items: the workplace health and safety guidance that's being released today, an overview of that from Kay Kennedy and Angela McDonald. And then we also have Dr. White again, frequent guest and no longer a guest. I told her she was now part of the K-12 education family. So welcome, Dr. White, back. Discussion, of course, of the guidance issued 2 weeks ago now in conjunction with Department of Public Health that we're calling our flagship guidance on the safety expectations and best practices. A continued discussion of that because we know that that is generating a lot of discussion in your communities, and we want to make sure we're continuing to listen to you about any issues on implementation and continued questions. And then finally, we're going to have a review of the executive order memo that we also issued last week that gives you some relief and some clarity on how NTI will be handled next year, as well as attendance and funding, knowing that many, if not all of you, are going to be participating in some type of hybrid learning. And as we know, our hybrid attendance models, as we know, our current system really doesn't address that. And then there's also, as a result of that executive order, an emergency regulation we're going to be proposing to the state board this week that implements all of that. And we're going to be talking to you about some elements in that emergency regulation to get your feedback. We'll take questions and comments along the way. This is an advisory, so we want you to comment, question, push back. And we want to hear from you. You're on here because of your expertise. So feel free to do that. I know this group will not be bashful. You can feel free to raise your hand on the screen down there. You can also post questions in the chat, and I will read the questions or comments as you do that. We also record the chat as part of the meeting minutes, so we incorporate that into the feedback. So I will, without further ado, turn it over to Kay Kennedy and Angela McDonald to discuss the workplace health and safety guidance document.
Thank you, Kevin. This is Kay Kennedy, and I will share my screen. And if you could please put your microphone on mute unless you are presenting a question or some other reason, so we can cut down on the interference if at all possible. So probably should have started with the PowerPoint. So let me try that again. So today, Angie and I are going to be talking about new guidance that was just posted today on the KDE website and is being sent out to all superintendents, I think this afternoon. Considerations for reopening schools, workplace health and safety. And this will be sort of a companion document, if you will, to the document that was put out by the Department for Public Health. And so hopefully we've drilled down into a few areas that that could be school specific to for your consideration and perhaps application as you develop your reopening plan. So today, as we look at the guidance document, the question that I'd like for you to keep in mind and then share back with us if possible is, what supports do districts need to implement the safety expectations and best practices for health and safety to reopen schools? Our guidance document covers basically 5 topics: your health and safety team, health resources and support, mitigation strategies, employee health and wellness, and student health and wellness. So the document itself refers in the introduction to the decision matrix that you may consider as you decide to return to school and what conditions are prevalent and on the ground in your school district. We have included in the document links directly to other guidance, either from the CDC or from other professional organizations that may be helpful to you. For example, the CDC decision tree to return to school is here. This is actually a link to the Kentucky Department for Public Health's document that we got a couple of weeks ago. So hopefully having these in the document itself will give you ease of access to the most current, should there be any updates following the initial release, but it'd be the most current documents that are available. So in our first guidance way back in May, we suggested that each district put together a team to help you manage not only the closing effort and graduation, but all things related to COVID, and in particular with reopening. This is a huge task. It will be all encompassing across your school district, all the operational areas, instructional areas, everybody's included. And so to help you manage that, we've put in a couple of links here that I think you will find important. There is a readiness and planning tool that will help you if you're interested in perhaps a checklist of items, and I'll show you that in just a little bit. It's a great way to make sure that you've got your entire team identified and on board with the list of tasks and activities that really need to be considered as you move forward. We also have helpful guidance from the CDC in terms of just opening a business. And a school is really like a business, and you're going to be opening your doors, and you're going to have people from various aspects of your community now entering the premise, and what can you do to keep that as safe for students, faculty, and staff as you possibly can. So again, the guidance is going to be particularly helpful if you can get to it quickly, and by putting the links in here, we've tried to make that as easy as possible. Now, the readiness and planning tool that I talked about really is divided into 4 categories. General readiness in terms of your district's policies and procedures, facilities and supplies, education and training, and any communications and messaging that you want to consider to get out to your students and their families. Each category in that planning document has a designated point person and a checklist of considerations that you want to keep in mind as you plan. I'm not going to read this entire document to you, but I would like to highlight some of the points that we've made here. Communications is going to be key, and I'm already seen through various social media the communications that many districts are putting out to not only survey their families, but to keep them informed of the process along the way. And I come from the school of you can never have too much in the way of communication to keep everybody informed. The other key factor that is absolutely critical to reopening safely is to work with the local health officials to understand how things are going in your community in terms of the disease and the management, with particular point to any contact tracing that may be going on with cases already identified in your area. Now I'm going to turn over the presentation as we talk about health resources and support to our state school nurse consultant, Angie McDonald. Angie?
Thank you, Kay. When I was starting to work on my portion of this document, I put my school nurse hat on and started thinking about the Healthy at School guidance that came out a couple weeks ago that we've been working very closely with the Department of Public Health to get to you. My first thought was, okay, this is the recommendations, and now what do I need as a school nurse to be able to implement this in my school? And I started just kind of making a list of questions that I would have as a school nurse, and I've tried my best to kind of go in the weeds a little bit to provide access to some of those answers. And as Kay said, we've used lots of links, and I've documented some of our most highly respected professional groups and their guidance. So that is going to be all throughout this document. This briefly talks a little bit about my position as the KDE State School Nurse Consultant. My goal is to provide leadership and assistance to school nurses and school districts. I do my best to give them technical assistance, help them develop any quality improvement measures. Sometimes it's just having someone to a shoulder to cry on and an ear to listen. And I do my best to try to stay updated with national guidance and promote that and distribute that to school nurses throughout the state as much as possible. I've added some links. Like I said, the National Association of State School Nurse Consultants has published the interim guidance on the role of the state school nurse consultant during a pandemic. So that kind of gives you a little bit of idea of what we've been doing at a national level to assist our school districts across the state. And I've also listed a lot of extra duties that the school nurse is going to have just during this process.
I don't think that's kind of. How would they do that? Erlanger kind of sits.
I think someone maybe need to mute.
What would they do? It straddles it.
One of those is developing flow charts regarding when students should see the nurse, when they should be isolated, when they should be home. This will keep other people who are working, making health decisions, whether it's LPNs, nurses' aides, trained non-licensed school personnel, to kind of give them guidance of what things they need to look for and when they need to contact the supervising nurse. You can go on down to the next page. We've added a lot of helpful things from the Asthma and Allergy Network. Has a great matrix on when a student presents with coughing symptoms. Is it more likely allergy? Is it more likely viral, or is it more likely asthma? And we've included that in there. And the National Association of School Nurses has guidance on the role of the school nurse. So I really hope you are keeping your school nurses at the table. They know your school inside and out, and they know the kids inside and out, and they're going to be able to troubleshoot a lot of things, and they're going to think of things that you guys probably won't think of when you're doing your plan to come back to school. The big issue, and it's an issue statewide and has been for years, is having adequate space for a school health room. Ideally, you would have a room with windows, proper ventilation. You would have a private bathroom and a sink. And in my 10 years as a school nurse, I was lucky to have a sink and window. So you do the best you can with what you have, because buildings are old and you just have to make do with whatnot. But at this point, you may need to reconsider relocating your school nurse for the year, because it's going to be very vital that they have running water at a minimum in their office, and really, if at all possible, a window, so they can crack the window, get some ventilation, and air out that space when there aren't ill students in that room. Also very important that you have a separate isolation area for students who are exhibiting symptoms, and have someone that can help supervise that room, because the nurse is not going to be able to see six students, do all of her other duties, plus monitor the room for students to be sent home. Proper PPE, the health room needs to be given priority for PPE that needs to be ordered for the school, and then any other school health service staff or those providing services to our students with disabilities that may need more intense care, one-on-one care. Frequent sanitation, of course. The isolation room and the health room is very important to be cleaned nightly, and the school nurses do a great job of cleaning and wiping down everything in between kids, their cots, the doorknob, if they've washed their hands or whatnot. But it's more important now than ever to continue those efforts. Okay, Kay? can roll on down. I've provided, as far as PPE goes, we have a definition of PPE and some helpful links that I've tried to add at each section that will be useful. CDC has one on strategies to optimize the supply. The National School Nurse Association has guidance on what type of face mask should be worn by school nurses and health professionals, when you should wear gloves, and the CDC also has some wonderful training videos on when to use personal protective equipment and how to put them on and take them off correctly. So school nurses can use these little videos to show the staff for any staff training that they may need, or even student training. Since we're talking about masks, I think we've all discussed this in great length, so we know that everyone kindergarten, first grade and up should be wearing a mask, a cloth mask, unless you have an underlying health condition or disability that would prevent you from wearing that. We do not recommend it for children under the age of kindergarten and down because of developmental. They cannot be, maybe not be developmentally appropriate for them to understand if they are not wearing it correctly. They may be having difficulty breathing and may not have the ability to remove that mask themselves. So we want to make those allowances for those students. And we've talked about with the school nurses that we don't want just parents writing notes because everybody's going to need a mask waiver. So we've discussed getting documentation from your medical provider, or this can also be an ARC decision for your children with IEPs. Okay, I'm going down. And we've got lots more links on PPE, hand washing, face coverings, social distancing. We know is going to be the huge thing, encouraging that 6 feet space when at all possible between everyone. And I know our nurses' offices are tiny, and so that's another reason we need to try to have an isolation room where students can be spread out as much as possible. Make sure they're wearing a mask. If they're having symptoms, they're going to be sent home. Okay. Temperature checks, we definitely want everyone to have a temperature check when arriving on school property, whether that's at the bus or at the car rider line, or if they're a walking student. Non-touch thermometers should be used. Not only is it quicker, but it avoids the use of respiratory droplets by using oral thermometers. And anytime that a student has a temperature of 100.4 or greater than 100.4, then they will need to be either sent back home with a parent in the car line, or follow your building protocol as to where they go next. Do they go to the isolation room and the school nurse is contacted? Do they have a point of contact in that building? It's very important for you guys to have that in your plan as to where you're going to send those students to be evaluated as to whether they need to go home or not. Employee health and wellness. Kay, are you planning on taking over that part there?
Yeah, I've got it from here. So as you contemplate bringing staff back into the building, it's very important, and especially in, just in terms of mitigation strategy, to make sure that you have a way to detect if folks present at the building with a fever or any of the other symptoms, that you have a process in place to deal with that. And for contact tracing, for example, at the state, we have to keep track of when you enter the building and what your symptoms are at that particular time, and then we use that information for contact tracing should it be necessary. But the main thing you need to do from a district perspective is to have your procedure down pat and make sure people understand what they're supposed to do when they enter the building. And should they develop symptoms as the day goes along, how do you want that handled? So recommended that you develop a protocol on how to handle employees who've been exposed to a person with COVID-19 or perhaps even tested for COVID-19. And think about things in your protocol, such as what's the notification process, what is the required quarantine or isolation when a person is sick, what's your notification with the health department, et cetera, et cetera. You can put other things in your procedure, obviously, but try to think about how you want to best protect the rest of your staff and your students. We have included a link here on considerations for school nurses regarding students and staff that become ill at or arrive sick at work, so try to build that into your protocol. Similarly, a student health and wellness assessment starts with the temperature check. We have encouraged you to use a parental home health assessment to get kids on the bus and do the temperature check once they get to school. You can do the temperature check on the bus if that works out best for your procedure. But it has been, as Dr. White has said on a couple of our calls before, the temperature check has been a really reliable indicator for a person who needs to be further checked out for symptoms of the COVID disease. Again, your protocol should address how you want parents to notify the school should their student be exposed to or have contracted COVID. Make sure they understand the quarantine or isolation procedure, notify the local health department. All these components, I would encourage you to work closely with your local health officials to make sure that everybody's on the same page and there's a clear understanding. Other resources that are available, there's some great guidance from the CDC and some examples of how you can communicate. There are free signage for all the mitigation strategies, social distancing, hand washing, where to take the temperature, all those items are available on the CDC. We've also included in this an example of a parental assurance for the daily student health assessment that we've talked about. Again, this is something that you can develop on your own, but you can put school logo, et cetera, et cetera. It's just an example. And then you've seen this in other documents. This is an example of the employee health self-assessment form that's used here by the local state government. The personnel cabinet put this out. And I believe it's turned in per pay period that the person attests to that they've done this health self-assessment. The other thing I would just like to show you before I wrap up here, and I have to so unshare this document, and now I wish to share this document. Which I didn't seem to be able to do. Share. Nope. Okay, I'm having trouble sharing this document. Practice does not make perfect. Here we go. Yay. So this is the checklist document that I mentioned at the start of the presentation. This again shows you different categories for consideration, gives you a way to identify your point person, and simply a checklist of activities that are important. This particular section is the daily or weekly readiness assessment. For example, if you look under facilities and supply, is there a person who is monitoring your supplies in terms of soap, hand sanitizer, paper towels, etc.? Is there a person who's monitoring cleaning and disinfection of the buses or other transportation vehicles? So this checklist covers policies and procedures. It covers communications and messaging. So it does put all in one place a collection of activities that hopefully will be helpful to you as you go through your planning. Okay. All right. That being said, Kevin, I think we're ready for questions.
Okay, questions, comments, feedback? Feel free to speak up, raise hand on the app, or use the chat feature. This may be a first. Kay and Angie.
I'll take it.
Actually, without having, we may get more questions from folks tomorrow. They've had a little time to actually sit down and study it a bit. So, see a question from Matt Robbins. If a student has a temp above 100.4, what do we require before they can return to school? So again, I think this is an important conversation to have with your local health department. The CDC guidance will generally say 72 hours, I think, fever-free. Dr. White, you may want to comment more specifically about that from a medical perspective.
Well, I think what we said in the document was that if the patient was tested for COVID-19 and was positive, there'd be an isolation period. And the local health department or the healthcare provider can tell you a time to return. If the COVID test is negative, then I would say that, again, the healthcare provider would determine whether someone was safe to go back to school or not at that time period. How would that normally happen? I mean, if a patient is COVID negative and they had that kind of a fever, I would say your normal protocols would kick in at that point. Dr. Messerly's on the call. Do you agree, Emily? As a former nurse or school nurse, or Angie, what do you do with a kid that comes to school with a fever? You're muted or something. No, I don't hear you.
This is Angie. Right now, the CDC is recommending if a student goes home with, for instance, vomiting or whatnot, it's if they're fever or symptom-free for 72 hours.
You definitely have to put on your school nurse pre-COVID hat. And if a child had a temperature of 100.4, the rule is 24 hours fever-free. So if you get a provider who says this child has an ear infection.
Emily, Angie was talking and she said CDC's got a 72-hour. You may not have heard her. So Angie, would you repeat what you said?
Currently during COVID, the CDC currently recommends 72 hours fever-free without symptoms or medication to reduce the fever. Okay. And I think they're just going on the side of caution, which is perfectly okay.
Another question about whether or not COVID testing, and I assume this was related to student testing, can be mandated. Whether the district, or I assume the district, can be required that they be tested if they're presenting symptoms before returning, if they're refusing to test.
Well, again, if you've got if there were no COVID and it was a heavy flu season and a child was febrile, would you require a flu test before they came back to school, or how would that normally happen in your protocol? Again, I'm asking out of lack of knowledge on this. I guess I'm having a hard time understanding someone not getting a COVID test, but I know that's something that y'all deal with in the real world all the time.
I think what we've already heard here today, I think typically it would require 24 hours fever-free. But if 24 hours fever-free isn't enough for the COVID test, and they refuse a COVID test, we would not forcibly give a child a flu test. Neither can we forcibly give them a COVID test. So 24 hours fever-free is what we've always been told. It's what's in our policy. We have a new virus that requires something different from that. And so the question is, if a parent understands that they cannot test their child and bring them back in 24 hours, do we have grounds to keep them out of school for 72 hours? That is not something that we would typically do. And you asked for what we would typically do. So I guess moving forward, we need to understand, are we playing by different rules where we can mandate medical tests? That's the question.
This is Dr. Meserly. One thing you can reassure parents of, there is federal support that no individual is to pay for a COVID test. So there's no mandatory out-of-pocket charge to any individual for a COVID test. So that should not be a barrier.
I don't necessarily think it's a barrier, whether it's a cost or not, but I mean, you could have a fever for any number of reasons. And to say you automatically have to get a COVID test to be able to return to school, I mean, especially once we get into flu season, at what point do we draw the line to say this is going to be the expectation? If it's 72 hours fever-free, then tell us that's what we need to do, and that's what we'll do. If it's 24 hours fever-free and that's what we need to do, tell us that, and that's what we'll do. But we can't be going back and forth depending on what season of the year it is. We just need to know what it is that we need to do if a kid has a fever.
And Scott, I'll add to that, a minute ago it was, talk to your local health provider and kind of see what the guidance there is. I think this needs to be consistent across the state. And, to Casey's point, we're talking about flu, but we're also talking about a national pandemic we've never dealt with before. So, the rules change a little bit in regard to this, and that's why we need something, I guess, a little bit more concrete in terms of, is it going to be 72 or 24? And, do we have the authority to stand on that?
So why don't we do this? This is something we need to flag. Dr. Meserly, Dr. White, between now and tomorrow's webcast, if you all could get with Kay and Angie and discuss, and then we can have during question and answer tomorrow, hopefully we will have some decision or additional guidance on this. And then Ashley Lant, I think you're on for Todd today. If you can also flag this for the issue that we may need to talk with counsel over there at the cabinet about the legal issue about testing that may go beyond the medical part, but about requiring testing.
And I do apologize for being so flat-footed on this question, because again, being public health, I never imagined that if my child had a fever, I would want to be sure they didn't have COVID. If I had a fever, I would want to be sure. So when you present that to me, I got your headlights look, I'm like, well,
with all due respect, you probably answer the phone when your school calls too. You'd be shocked that.
Yes, I would do that. So
Kevin, this is Kay. I think we all also want to answer the question from the employee perspective as well. If an employee presents and what are the rights and responsibilities of both the employer and the employee as we talk about any mandate to make people take tests and force people to stay at home or that gets into the whole isolation and quarantine question as well, and how prescriptive can we be from a legal perspective. So make sure we include that.
For the record, I had a test done last week, so I can actually say, yes, I know what it's about. So.
And Dr. White, I guess one thing that continues to concern me, I can't wrap my head around, maybe you can explain it. When we talk about a child with a temperature, and whether it's 24 or 72 hours that they return to school, if they're not going to be mandated to have a test, why are we doing the contact tracing? Because if they were at school or in contact with other children at some point and they had a temperature, and we know this, there is that possibility that it is COVID. If we don't test that, then they could have been exposed to any number of children. But if we don't know if they don't test and we don't know they're positive, then we've effectively allowed them to contact others, before we could quarantine it. And yet, how are we going to contact trace? And that's where I'm confused.
Well, we can only contact trace with a positive test. We're not going to contact trace everybody with a fever. So that's why, again, I'm a little baffled that if there was a chance that I had a fever and with unknown origin, or my child did, I would want that test so I could do all that. So that's why I'm going to have to step back and try to put my head around, how do you do this when you've got an uncooperative family?
And we did ask these questions of our local health department. I last Thursday, three school districts got together and met, and their response was the same. So if nothing else, take from this that not everybody's as reasonable as we all are on this call. But we get this all the time. So if someone finds out that there's only a 24-hour keep my child out of school, if they don't test their child, know that will be the go-to for some people, is they'll refuse to test. So
well, it's clear that it's at least 72 from what Rob and what Angie said. But I think Dr. Mesley and I and we need to come up with something clearer, and we're kind of floundering at this point. So we will have something concrete for you tomorrow. Dr. Mesley?
There is, yes, I wanted to make a comment that just very, very recently, the CDC has come out with guidance that they do not recommend any blanket testing of asymptomatic individuals. So if you get questions that staff or students have to have a test before they come to school or before they come to work, the CDC is not recommending blanket testing of school students or staff before returning.
I saw something recently from the CDC that said you had to achieve 10 days symptom-free.
Yes.
Now, that may be for those who've been tested and are positive.
Would mask up, you could go back to work. If you were an EMS or two people out of the fire department in some small communities is half the fire department. So they were trying to find safe ways to get people back into the workforce if you were an essential service person.
Is it fair to say that the contact tracing, if we leave it up to the local health departments, like mine's great. Britt Blevins is in charge of mine here in Danville, but it seems like it's going to be implemented. There's going to be a wide range of how that's implemented across Kentucky. I've talked to some superintendents. It sounds like theirs is going to be impossible. Because it'll be, if you have one kid in a 4th grade class and they change classes, you may be 120 students are going to go home for 14 days. Those kinds of scenarios are really impossible to implement. So what are you all hearing? Do we need some kind of state guidelines on contact tracing, or is it okay, do you think, for let the each local health department guide their districts?
Well, those contact tracers have had some universal training. So the contact tracing rules are not that varied. It's if you've been exposed for a length of time in close contact without both people being masked, you're in either the low risk of having exposure or the high risk. And if you're in the high risk, then you're quarantined for 14 days. Because what you don't want is all 120 of those fourth graders, or even a quarter of those 120 fourth graders, going home and spreading that to family or other teachers. So the question is a good question. Is contact tracing going to be absolutely the same in every health department? No, because they're different personalities, different people's techniques of how they do the interview. Some people are going to be more forthcoming to one interviewer, and some interviewer may not have, good touchy-feely skills, and the person may not give them all the answers. So I'd love to tell you that it was going to be completely uniform across the state, but we are working as hard as we can to keep it as uniform as possible.
Here's another thing to think about, though. So if you get a third grader somewhere who's test positive, we've got to make a real quick decision, I guess I would think we'd make quick decisions. Maybe we don't. Are we going to let all those third graders return the next day, not knowing? So we know that one was positive, but the contact tracing hasn't played out yet. So then do all those third graders come back to school the next day, and we wait however many days it takes for the contact tracer to do their work before then they tell us, well, you need to send these kids home? It seems like we need to make those decisions quicker than that.
Yes, and ideally, if you've got someone you suspect, then that person gets tested, and you would hope to get a result within the next day. But you're right, the more of those people that were at high risk exposure need to be aware of that. 24 hours is our gold standard for how quickly, once we get a test result, that we contact everyone and get them get them in quarantine if that's appropriate. That's the ideal way it's going to work for exactly the reason that you just said.
Dr. White, my understanding is in my county we have maybe 3 or 4 contact tracers. I don't know what the average is by county. My concern is I share a county with another school district, as well as several large manufacturers, as well as a hospital. So I'm thinking, how are these 4 people, and I know they've been trained and had training, who are they going to be working for, and what's paramount? Because they're over here trying to figure out how Pella Windows is running their factory and how to contact trace over there. We have an outbreak at the hospital. We're trying to backtrack that. Murray Independent has an outbreak. Callaway County Schools has one in 4th grade. And I'm just wondering, do we have enough people trained? Back to Mike's question, how quickly can we get on top of this and eliminate exposure risk?
Well, I've been in 2 hours of Zoom calls this morning about contact tracing, and I know that we've hired over 700 people in Kentucky to work with contact tracing. So ideally, those 4 people that you're talking about, those are the people that your community wants to talk to. They don't want to talk to somebody from Rochester, New York. They want to talk to somebody from your county. But what we've done, I haven't done anything. I've got you guys. I don't do the contact tracing, so you're my assignment. But the contact tracing folks have worked out a system to where if there is, as you said, 3 big things are happening at once, there are people, contact tracers, that can at least begin to take the overflow, get the contact tracing started, get those initial phone calls, get that initial information into a database that your local health department can use. So that's what we've tried to do, is hire a bunch of people. Ideally, they would all be your people and everybody would know them in the grocery store. But in a situation like this, when you've got Pella Windows and a 4th grader, your 4 people can't do that. You're absolutely right. And so that's why these extra 700 people have been hired, so they can go overflow into different parts of the state. And isolate everybody that's got this disease, and the immediate people around them could be quarantined. That's how you stop this thing, or at least mitigate it. But it's a big job.
And a SAC webinar.
So we are obviously, now we're into our second, this was a good segue because we're now into the middle of our, I think, overview of these issues with public health. So we're in our second agenda item. Dr. Meserly, you said something I want to clarify, because I think you talked about the CDC talking about blanket testing is not recommended.
Correct.
However, we have been, and the governor and others, public health have been.
Put a rash on it.
messaging that we're encouraging districts to encourage their employees to be tested. I think the governor threw out an ideal scenario of 10% of a district's employees would be tested every week, not mandated. But what's different than encouraging everyone to get tested versus no blanket test? What's the difference there?
So there is no harm in being more cautious than less cautious. I just want you to know that, especially for students, for the student population, the CDC is not recommending blanket testing of the student population. As we've gone through all of this guidance, though, in your school building, your adults, your teachers, and your staff are more vulnerable to COVID-19 than the children. The children are more the carriers. So doing testing with the staff members does make more sense, because the adults are the more vulnerable population.
We are just about ready to finish up next week, I believe, of testing all staff members and all nursing home clients in the state of Kentucky. That was a real exception. Exception to what the CDC says, that you shouldn't just go out and blanket test everybody. But since about 68% of our deaths in Kentucky are in nursing homes, it was felt like this was an exception that could be made. So that shows you that there's recommending that you do it for the better good, and then there's, holy moly, the data tells us we need to be checking everybody to be sure we're doing it correctly.
Okay, that makes sense. I got one question that came in on my text. I'll read in a second, and then we have one on the chat we'll talk about later about the American Academy of Pediatrics article last week. The one on my text is regarding what about student employee or employees of districts and student athletes who go to one of the hot spots. For example, you know, just through the community grapevine that you've got the Brown family went down with the Smith family down to Myrtle Beach, and now they're coming back, and now Kevin is at football practice, etc. What are we saying to districts, knowing that they do not have? And the question is, I think some districts have been asking those folks to self-quarantine for 14 days, but acknowledging that they don't have that enforcement authority. So, what are your all's recommendations and comments on that type of scenario?
So that should be in the KHSAA guidance, am I correct? Because it's athletics? Is it not?
Well, it would apply outside of athletics as well, I think.
You're talking about during the school year. Okay, during the school year, not just now.
You're going to have, even now, sure, you're going to have things going on at school beyond athletics. So it's more of a general question. The athletics was just used as an example.
Mm-hmm. So over breaks, if families travel to hot zones, I don't think we have not addressed that in our guidance.
And, that's going to happen. It happens even on a weekend. You have a lot of families that go to Pigeon Forge, Gatlinburg, Indiana, to the pumpkin farm, wherever you name it, there could be folks going to hot spots. So I'm going to write that down as something else for us to get together on and follow up for potential guidance.
Okay.
And then the question in the chat, there's several folks commenting on that. And this, Dr. White, you may not have had a chance to read your email today. We also got that from another district. There was a report issued. I don't know if it was a report or it was there was definitely an article about it on National Public Radio and some other outlets. The American Academy of Pediatrics talked about the importance of students being in in-person classes, and kind of that outweighed a lot of the other risks, just them getting that education in person. And I think there was some, and I haven't read it, but this is just from what I've been told. There was some recommendations that, or it at least implied that certain age students, below middle school age, should not be required to wear masks. That type of thing going on, mentioned in that report. And so we're getting a lot of questions, since that is a reputable group. That is less strict than our guidance that we issued 2 weeks ago. So I know you all may not have had a chance to review that, but if you have had it, if you have any comment now, if not, if we can also maybe defer that till tomorrow.
I believe, Dr. Mesley, have you looked at that? I know that she sent it to me earlier today, but I haven't had a chance to look at it myself.
We will confer for now, but there still is the CDC guidance of 2 years and above, and we have changed that to first grade. So we're already 4 years above the CDC guidance in that respect. But we will look at the AAP guidance and see if it changes our guidance at all. But nothing is changing yet.
And then mention the CHOP guidance too, so they'll know what that is, what CHOP is.
I think that brings up a good point, though, just because I've done quite a bit of reading on this topic. I've seen the American Pediatrics report, read that. Just in terms of the general public, you know, we have such a fear around this virus, but there seems to be some solid health information regarding children and COVID-19 that I just don't think the general public is quite in tune with, that might relieve some parents' fears about sending children to in-person school. And I don't know how we do a better job of that, but there's a lot of solid information with regards to children in this virus that I think we need to really promote and push a little bit harder, as opposed to a lot of the negativity that we read and listen to on the newscasts at night. And that's our general public. That's what they're consuming. That's what they're taking in. And but I do think there's a lot of positives that we can tell parents about this virus and their children.
Yes, there are. My point to drive home would be that children wearing their masks, it's protecting their parents at home, it's protecting their grandparents at home, and it's protecting the staff members in the school as much as anything.
But my point would be is that I don't think that information is being promulgated by a higher authority that would give it more credence.
Okay.
You know, so if I say it, it's one thing, but I don't. You know, I'm not a doctor or physician.
Sure.
And I think there are a lot of positives from the parents' perspective about their children, because nothing gets more sacred to a parent than their children. And there are a lot of positives about the virus as it pertains to their kids. Certainly, there are others around, including the parents themselves. But they're primarily concerned about their children. And as this virus, as it pertains to their kids, I think there's a lot of strong health information that we need to do a better job of. I'm not saying it's you all or us, it's just as a society, we need to do a better job of educating people about that than what we've done. Because when all you consume is the nightly news, it's pretty bleak and dark and dim.
Right.
And what that's leading to, without having that positive information, I think is what we're saying is that that's leading to the parents and the families that are answering these surveys and talking to these superintendents at church and at the grocery saying, I'm not sending my kid in at least for a few weeks, maybe even a few months, or maybe not even next semester. And so now the districts are having to wrestle with, are we going to provide this hybrid instruction because of this?
Exactly. You hit it right on the head.
Yeah. Okay. That's a good point. And we know we're talking in general about doing some more promotion at a statewide level, just on mask wearing, but it's beyond that. I think we need to be a little bit more nuanced in how we're messaging that. I think that's a really good point. Just for everyone's knowledge, Superintendent Allen posted the link to that American and the Kentucky Educational Development Corporation, which is one of our educational cooperatives. Their task force committee is bringing out some positive marketing. And we saw a little bit of a taste of that. That was one of the videos that we show, or the video we showed at the governor's press conference 2 weeks ago on the wearing a mask is cool campaign. So we appreciate that. We know there's a lot of that starting to happen around the state, and hopefully Dr. White has her nice, looks like a paisley pattern there, mask. Hopefully when we start seeing some UK U of L athletes walking around campus with masks and some of that starts going out, that will help our efforts in our communities. But it's going to be obviously still a very heavy lift. Other issues, we're now down into the public health portion of our agenda, related to the overall guidance issued by Public Health 2 weeks ago. This has been great feedback. It's actionable, and that we need to go back and clarify some things. It's exactly what the advisory councils are for, so I want to thank you all for that. We've been very clear in all this that, and it's been stated in the Healthy at Work guidance, that has changed and evolved over the weeks and months due to feedback from employers, but also as the virus has changed. So this is going to be important that we continue to have these conversations. We hope to have more clarity on these three major issues: the mandated test issue, whether the 24 to 72 hour issue, the hotspot travel guidance. We may not have that guidance out yet, but maybe some additional discussion tomorrow, and the additional feedback from public health on the AAP report, hopefully tomorrow on the superintendent webcast. Any other issues that we need to bring to the attention of our friends from public health or about that document? Feel free to speak up or put it in the chat.
Kevin, can you hear me?
Yes.
Just a question. One thing that I've been wondering about is what metrics are we going to look at if we're talking about spiking in the fall, and what may lead to a closure, what may not lead to a closure? Do we have any actually levels on that or any type of metrics on that so that we can kind of keep our eyes on that? You know, last year we had about 36 hours of notice to go to an NTI. It would be nicer if we could keep our eyes on those trends so that we can make a better informed decision.
I'll defer to public health on the metrics. I will say, and the governor has said also, and Dr. Stack, about due to the ability of using the contact tracing, we think we're going to have the ability to be more surgical in that if there is an outbreak, as was mentioned earlier as an example, perhaps a fourth grade in Callaway County, while we don't want it to happen to that fourth grade, we think now we have the ability to isolate the fourth grade, or maybe even isolate part of the fourth grade that was around Kevin at the cafeteria and on the bus ride, as opposed to closing down all of Callaway County or closing down all of Western Kentucky for a period of time. So that's the good news as far as those metrics and what that looks like on the ground when that may become necessary. I'll turn that over to public health.
There really is, and I know that this question was asked to Dr. Stack on a call a few weeks ago. There is no exact science for when we decide to close a school, but it is definitely a combination of communication between a principal and the local health department and the contact tracers to see if they are seeing a trend in either your county or your school. But there's no calculation as of yet, but every day new science comes out, and I hope that we will have a great tool to use in the near future of here's when you need to close your school. But contact tracing should minimize school closure, and just like Commissioner Brown said, it should maximize that targeted isolation of classrooms or grade levels rather than entire schools.
Do you all sense that there's that there probably won't be statewide closures, that you're going to let us handle it like the flu, or do you think there could be a point where there would be a statewide closure?
Well, the governor, and correct me if I'm wrong, Commissioner, did talk about doing some regional pauses. He likes to say pauses instead of closures. It sounds so much nicer, I guess. But he did talk about looking at things regionally, and I think he was talking about the economy when he said it in his press conference. But I would think, now, Lord knows, the governor doesn't consult me on these things, but I think he's beginning to try to introduce the state to the fact that if this part of the state is doing really well, then we don't need to give the same treatment as this part of the state that happens to have a huge community spread. So that is my understanding. That's why he's been really pushing us on the contact tracing, which we already knew to do that, but it's always good to have that power from above supporting that contact tracing or any project that you're trying to do statewide. So I think he sees this as a way to keep it not a statewide closure. Now, October 1, he may come out and say that. I don't know, but I think everybody has seen what happens when you do a statewide closure. And tomorrow, I've got some slides that Dr. Stack put together this morning for a health department director call, and I'll warn you guys. I just want to show you how well Kentucky is doing. I mean, you compare us to other states, and people in the state, you folks, the local health departments have done an amazing job, and I think if we can all see how well we've been doing, but if something happens in Callaway County, there isn't any need for Elliott County to change what they're doing unless they have the same issue. And so I think we know we flattened the curve beautifully with what we did, but there was a toll that came with that. And we're recovering from that at this point, but can we more surgically approach this for our economy, for our children, for all of the other issues? That would be the ideal way to do things.
If I could ask then, because obviously as superintendents, I think we're seeing the extremes on both ends of the spectrum and not a whole lot of the centrist. Would there be a way for public health and the state to give us some real good, clear guidance to share with parents on when a school closure versus when not a school closure? Because I have a sense that if we have some pockets in a 4th grade class, a 6th grade class, or whatever, there's going to be some folks that are like, you all need to shut down completely, And I understand contact tracing, but I'm not the expert. And I think you'd have to be an expert to be able to make it simple enough for people to understand going forward. If we could maybe have somebody work on that, that'd be great.
And possibly, I don't know, Commissioner Brown, I'm not familiar with the KEDC task force, but they did a bang-up job with that video. Possibly if we could get some language to them that they could put in the format that they did to show, because you've been around somebody, if you're low risk, you don't need it. If you're high risk, you do, and why. I think if we could make, and I will check with our contact tracing folks, they already may have that kind of information because we've got a pretty powerful group, and I know they have a communications section. So I'll check with them to see if they have something. If they've got something, I may also bring that to either this group or the Tuesday group and show it and say, do you think this would speak to your parents, or do we need to do something specifically for parents? And we'll be happy to do that.
I think that's good, and I also think we're talking about 2 types of communication and 2 types of timing. A communication on the front end when it hasn't happened yet in Callaway County or anywhere in the state, to just making folks understand a little bit more about contact tracing and how it enables us to be able to be more surgical, but say it in different words. But then let's say we did have a closure at the 4th grade in Callaway. Additional communication pieces that we can help districts with communicating to the community. Well, here's why only part of the 4th grade is quarantined, and while the rest of the elementary school can stay in and come into class, and why that is still safe. So I think we got 2 types of communication, and KDE can certainly work with public health on getting those types of draft communications for districts, as well as the co-ops that are developing some of this as well.
I'm on that. I'll check with Trish Okeson, our other deputy commissioner. She'll know whether these things are available and can get me what we've got so far.
Yeah. Because what I think districts are afraid of is if that 4th grade quarantines, as bad as that will be, you're going to have some panic and parents saying, well, wait a minute. I want to go to NTI at home because I just, like the others, just to be safe. We want to make sure we're getting them very accurate information to, allay those fears.
Yeah, one thing to go along with what Kevin's saying is when, we don't have a magic number, any of us, but if you start having a school that's 85% attendance for 3 or 4 days, you can't keep them open. I mean, you got to go to some other kind of option. So you may only have 1 case that's in 3rd grade and we think we can contain it, but then there's widespread fear and then they all go home, your 80% attendance, then you've got to close. That's what I'm afraid is going to happen to us.
Well, luckily funding isn't based on attendance this year, right? Am I right in that?
You're leading us right into the next segment here.
But the reality
right.
is, Mike, back to what Mike's saying is, and I'm thinking about our adult staff, teachers and bus drivers. I mean, I'll just be honest. If I lose 8 bus drivers to a quarantine, I can't have school anywhere in the district. And that's just a reality. And I don't imagine that substitute teachers or bus drivers are going to be knocking down our doors this year to get in proximity of children who are carriers of this disease.
Well, and that's good. The move you all made on attendance was a great one. But if you've got a 4th grade, 1 case, and we think we can contain it, and so we send 30 kids to a quarantine, and then our attendance drops for the kids who should be in the building to 80%, the learning environment, we'll have a virtual school going on, we'll have a quarantine school going on, we'll have 20% who should be there not there. We'll be trying to juggle so many balls in that school that it becomes just undoable. We really need, in that situation, we need the parents to trust us, and if we send the 4th grade home, then they're all like, the rest of the school's good. And then we continue the 95% attendance everywhere else. That's going to be a real key component, is the parents trusting us when we make these moves.
Well, my concern is also that it is not the student metrics that ends up governing what we do. We may have among adults in the community that may be carried by asymptomatic students in the school that may drive what we end up doing anyway. And it may not be our school metrics and the attendance at school. It may be other metrics. And Campbell County, for instance, we've got 6 school districts within the county. And so it may not even be my district that governs what I end up doing. And just the community and the adults may be the metrics that end up driving what we do and when we do it.
Yeah, communication on both ends of this is going to be key, and it's going to take all of us, I think, to deliver that message. So I don't think, go ahead, Dr. White.
I was just going to say, you talking about your bus driver. So little Kevin gets on the bus and he gets in the back of the bus, or even if he's closer to the front, there's a seat between the student and the bus driver. If I were a bus driver at my age with my health issues, I'd be wearing a mask. Little Kevin's got his mask on. That bus driver may be low risk, depending on the interaction and time spent with that child. So it does not mean that everybody on that school bus necessarily needs to be in quarantine. It doesn't mean that that driver needs to be in quarantine. So again, by trying to do some of the things that we've asked to put in place, that's going to decrease the number of people that will have to be quarantined.
If you continue to have issues, or I think someone else is speaking, go ahead. If you continue to have issues or questions related to this agenda item or even the workplace health and safety, feel free to put that in the chat. Also, there will be a exit slip for you to utilize, a very brief survey instrument to tell us about how today's meeting went, but also about additional information or thoughts you may want to provide, even if you may not be comfortable putting it in the chat. So this is a great segue because the question was raised about uncoupling attendance from funding temporarily to get us through this period, which leads us to our next agenda item. Dr. Foster and Robin Kinney, I'll turn it over to you.
Good afternoon. This is Robin Kinney. I'm going to try to walk us through sort of where we are right now related to pupil attendance and funding, really talking about the next school year and its impact on funding for the subsequent school year that follows. As many of you are aware, and you should have received copies of already, the memo that was provided by Commissioner Brown and signed off by the Lieutenant Governor as Secretary of the Education and Workforce Cabinet on June 24th. And really what that memo sets us up for is to allow for, in 2 primary areas. First, seek funding to be addressed in a different way, a different manner, as we look toward the funding for that next school year. And also NTI, and addressing an NTI, an unlimited number of NTI days. If you'll think back, it seems really long ago that we were wrestling with this issue when we were winding down this past school year, and Senate Bill 177 that was passed addressed both of these components. And so really what we're trying to do is kind of move that forward for one more year to look at ADA in a different manner. So what we'll do is this executive or the memo that was signed by Commissioner Brown as well as the Lieutenant Governor addresses suspending provisions of the SEC funding statute and also certain provisions of Senate Bill 352. 352 is the last biennial or the annual budget bill, and that provides for ADA to be utilized in certain state-funded other applications, not just SEC. So this is exactly how we finished the last school year. We're going to move it forward. I think it's important as I talk through with you a little bit about what the emergency reg is going to look like at this point in time. Commissioner Brown always encourages, and we here at the Kentucky Department of Education always encourage your feedback and your thoughts as we go through the regulation process. We will be appearing in front of LSAC, I think, later this week, as well as in front of the Kentucky Board of Education. And the need for this emergency type regulation is to really try to put into place as quickly as possible a little more certainty in this uncertain times about what funding is going to look like. So if we start with just the SEC funding formula regulation, 702 KAR 3:270, we are going to utilize the ADA, which was selected by each district pursuant to Senate Bill 177. So all your districts just went through this exercise of looking at which was more beneficial for you to either use that data of 1819 or 1920 for your data information for the next school year. So you're using that for the school year coming up. That's already in place. And we're going to use that again for the next school year for funding. As part of that, there are components that are not directly ADA or partially ADA related. And so just like for this school year, we will use actual current year counts for those. So those are your counts for at risk, home hospital, and SEC transportation will actually use the prior year data, the ADA data, because those all have ADA components. But we'll use current year data for property assessments, exceptional children counts, LEP student counts, state equalization, all those other ones that are not ADA driven will use your current year counts. So that's really important that you kind of have an idea of what that's going to look like. The other piece that's going to be covered by the emergency regulation is under pupil attendance, and that's 702 KAR 7:125. And you will see in this a heightened emphasis and requirements for participation. So we're going to move away from this attendance funding discussion because we'll have taken care of that through the suspension of the SEC funding statute and then also looking at current year counts. And then we'll turn to a participation look. And this will be for non-traditional instruction. We're going to use participation and we're going to look at it in two ways. First, for your students that are in school. So they are in your school building, they are in person. You will do basically what you have done before, but we will call this participation, not attendance. So for your elementary schools, you're going to be taking attendance once each day. Middle and high school, you're going to take it by class period, and you'll still do your entry and exit logs. Very similar to what you do right now. So let's turn to NTI for participation for those remote students, those non-traditional instruction students that you are either providing your instruction to through technology or you're providing it through paper and pencil. And either one of those, we are still going to request that you record participation. And we've come up with ways that you can do that. For many districts that already participated in NTI, you're familiar with participation. Many districts that moved to NTI in the last school year due to the coronavirus pandemic, you became familiar with participation. But we're going to outline in this emergency reg how you can provide evidence of participation. In order to do that, it's important to say this will be measured by interactions between teachers and students. It will be measured by student engagement, but not performance. You still have your grades, you still have graduation requirements, all that will be separate. So it will be measured by student engagement, not student performance. And you can measure it either during the school hours, the regular school hours of your school day, or outside of those school hours with at least one of the following measures. So we envision that your teachers and your students will be communicating either by, they can do one-on-one video communication or telephone calls, and that can either be between teachers and students or teachers and parents of younger students. You could have group video communication or group phone calls. That would also count as participation. You could have your students logging in to a learning management system and completing work. That is also evidence of participation. Or you could have submission of paper-based assignments. And it will be important in order to show that evidence of participation that you will show participation for each student each day. But we do understand that, especially for those students that are more utilizing the paper and pencil, you may need to record those on a weekly basis rather than a daily basis as assignments come back in. Why is this so important? Why is it important, especially since we are moving away from that tie from attendance and funding? It's very important, and we've already heard from interested constituents, parents, legislators, as we close down the last school year. How do we know that instruction is being delivered? We know that teachers work hard each and every day to make sure that their students are engaged, but it will be a little trickier when we move to a more remote instruction scenario for a longer period of time. So I do think there's great interest in participation and the evidence behind it. So therefore, we will require some reporting to happen for both in person. And again, that's under your regular, how you usually do attendance, which now is participation. And we will also ask you to report on NTI students that are learning remotely. We will ask for you to report that to us 3 times in the next school year. The first report will be due in October, the second report in January, and the last report will be by July 1st of next year. This will allow us to engage and inform those interested parties of how participation looks in your district. And we would also encourage you to keep that at a school level so that as you have parents and interest at the school level, you can also provide that information at a school level. The participation numbers after each report will be posted to the KDE website and also provided to the Legislative Research Commission. We know that this is going to be different for your teachers and your staff in your district. And so the Office of Finance and Operations and the Office of Continuous Improvement and Support, we are going to team together to provide assistance to districts about this new way of doing things for participation. We've already had conversations internally of what that would look like. We will not be doing attendance audits at the beginning of this next school year because quite frankly, we won't have attendance being counted. So we're going to repurpose our staff here to support you and to help those that are working on participation reports to make it happen. Participation will be reported through Infinite Campus on a daily basis. So you're not reporting how you, the evidence of your participation and how you know that it's there. We'll ask you to keep that at the school level. But we will ask you to record that daily participation for your students at Infinite Campus. And Infinite Campus is working on that right now with Kentucky as well as other local school districts. So these are all rolled into the proposed emergency regulation that has been drafted and will be considered by both LSAC and the Kentucky Board of Education later this week. If anyone has any questions right now about kind of how we envision this working and the reasoning behind that, I'm happy to try to answer any questions at this time.
Matt Robbins here. I just want to mention, first of all, I want to say thank you because both of the 2 items that you mentioned are enormous help to us. And that stabilizing of our funding so that we don't have one less thing we've got to be focused on and knowing that we're going to be penalized with. One other question, I've brought this up to Dr. Jim Flynn, our CAS director, is within the in-person instructional day. My district is now at 6.5 hours, less, more hours than that, but we deduct for, non-instructional time, et cetera. My point I'm getting to is with COVID-19 and with, trying to do so much diversity with our lunch shifts, providing lunch with kids, hand washing, dealing with masks, and all those things take time. My question would be, is there any flexibility within the confines of what we now term as the instructional day and the instructional hours that we have to accumulate? Can that time be a little more flexible than what the regulation calls for currently?
I think right now, and I'm kind of reaching out to Matt Ross, my policy advisor, as well as Che Ritter from District Support Services. I believe that flexibility is statutory. So any flexibility that is there. So we would have to revisit it as far as an additional executive order and sign off on that statute. So I'll double check on that first. I would really be interested, because we've had this conversation, at least internally, and I've received some questions from superintendents about this, about where is the tipping point between making sure that you continue to provide adequate hours of instruction, knowing that you have these additional burdens on you for cleaning and sanitizing and all that. Right now it talks about a kind of a 5-minute allowance is one of those that can be counted toward instruction. So as educators and professionals that deal with this boots on the ground every day, I mean, what is the amount of time that you would recommend to be built in and still preserve the primary mission and focus of our school districts, which is to educate and have enough time for instruction? I think that's what we're struggling with a little bit.
Certainly. And just to give you a case in point, we're not unusual to county school districts. We do a looping system from our elementary to our middle high school. And in order to, let's say, dismiss at the middle school level with, I'm not getting the term I'm looking for here, so that we don't have all kids dismissed at the same time. And, we could spread that out over a little longer period of time. The question was asked, could our elementary buses get there a little bit sooner? And my response to them now is, that's our shortest school day, so we're held to that. And it's 6.5 hours, and we need all 6.5 to get to the 1,062. If I had probably 15 minutes of flex there, just as an example, that would give us a whole lot more latitude to dismiss in a different fashion, so that we didn't have all of our kids trying to board school buses in the normal nature that we're doing now. So that's just one example that's popped up on my radar recently. That was maybe 15 minutes. I'd hesitate to answer what would be the exact number of minutes there, and I can see the conundrum that you're talking about. But I just would say it is a little boxy based on a system that is, pre-COVID. It's not of a concern for us, but if there was a little flexibility with counting time that is, eating lunch, period, whatever, and even if it were standardized, that would be helpful. So let's say it's 30 minutes, we'll give you 15 minutes or something. It gives us that much more time to consider other alternatives that fall off of that.
Okay. We'll take that back and keep on talking about it.
Thank you.
And Robin, to Matt's point, if you're virtual online or if you're in an NTI setting, we're not counting minutes there either. We all know what's ideal, and we respect what's in statute, and wouldn't be asking these things if it weren't, impossible to do what we have to do in order to have in-class, in-person school. Because Matt's exactly right. Busing is a huge issue, and following the guidance of the health community on how we need to stagger that to eliminate contact between students. It's almost a necessity that we have some play within those instructional minutes, even expanding our days, by an extra 20 or 30 minutes to accomplish that.
So, of course, I mean, you can expand and have more minutes. Of
Right.
course, that just makes your days longer. It's, the difference between instructional minutes and the length of your day can be different. And I think the other thing that we've heard from superintendents is, especially for our elementary schools that are having in-person instruction, they really don't want to make a longer school day for those elementary kids because it's going to be difficult as it is. So, just trying to find that balance is so I appreciate this discussion. If any superintendents have a better idea about what that added flexibility might look like, trying to give you maybe X number of minutes in the school day rather than saying what it looks more like now, which is 5 minutes between classes or something like that. That doesn't really provide you a lot. So we are very open to continuing to hear this discussion because we have heard this over and over.
And I don't know that I don't see that a lot of schools waste time now. So that if we look to a bell-to-bell time frame with a maximum of the 7 hours, what might that yield? So that we kind of just eliminated the boxiness of it altogether. Because really, aside from eating lunch, I can't imagine too many kids, or in most Kentucky schools now, are spending time doing other things. So that's just one idea I thought of, is what's the bell-to-bell time frame not to exceed 7 hours a day was a thought.
Before we move on, this is Greg from Oldham. It's hard to qualify some of these things that Matt and Trey are talking about. I mean, I guess it comes down to a 5-letter word called trust, that we are being asked to perform in a way that we've never been asked to perform or even designed to be performed. And normally I'm really happy when the legislature is not in session because it means there's not more stuff coming my direction. But with the legislature not being in session until next year, January, a lot of these questions, it would be very soothing for superintendents to know we had that flexibility going into day one with those things through either executive order or through whatever, versus having to wait until the legislature comes, because obviously nobody wants to get into a situation where we're paying back time at the end of the year or we get our hands slapped or anything like that. I would just urge that there's not a single superintendent on this call, nobody on the screen that doesn't want the best for all of our kids, but we're being asked to do a lot of stuff and still being tied to a lot of old regulations. All we're asking for is 1 year grace until we get out of this COVID, then we can go back to all those regulations that we need to be in.
Thank you, Superintendent Schultz. I think you're right. I think the department has been willing and continues to be willing to listen to anything that we can do to grant that flexibility. What we're doing through both the memos, executive order, and then the changes to emergency regulations. I think Commissioner Brown has said this will be the first step. We continue to invite, and we may need to make some additions along the way. Of course, the General Assembly is interested in what we're doing, and we'll be appearing in front of the Interim Joint Committee later this week to talk about the attendance and funding issue. And I think we'll hear their feedback from that. I think relying upon what they did in Senate Bill 177 is really the best way for us to say, look, we've listened to what you did. It was a good result. Let's just carry that forward 1 more year. So we'll see if they have other communication with us at the Interim Joint Committee meeting. But the commissioner's very open, as well as KDE, of trying to provide the flexibility that you all need. And if we need to go back and do another executive order or change an emergency reg, I'm sure we can do that.
Yeah, absolutely. I completely agree. As I've said before, we're also trying to strike the balance of deferring to the General Assembly when appropriate for decisions that don't necessarily impact the beginning of the school year, that can be decided in the General Assembly, deferring to that, co-equal branch of government. But obviously the things we're talking about now impact, us now in the first semester of school. And just know that, in a representative democracy, criticism, that's what our form of government is built on, and I'm not afraid of criticism, but we are likely to be criticized for exactly what Robin just went over in this plan to waive the SEC requirements. We just will. We'll be criticized if we don't do anything. We will for this, but to the extent we do get criticized, I am going to ask all of you. I need you to talk to your members of the General Assembly about why what we have done is necessary. And I believe once all of the members understand that, they will be okay with it. We're in a global pandemic. They're not meeting. We have to use the tools that have been given us. The governor has executive order authority. They may want to argue in court about all that, but I'm not worried about that. They can figure that out. Right now, I know I have these tools. You've told us what you need, and here's how we can deliver it. About the only way we can deliver it is what Robin described to you through the memo we issued in conjunction with the Lieutenant Governor, which is pursuant to the governor's emergency order and then the emergency reg. So obviously there will be criticism and comments, and that's how it should work. But I am going to need you all, if it does go there, to make sure you're having a conversation with your member of the General Assembly that how important this is to get us through temporarily this next school year.
And Kevin, I would echo that, especially as to the timing of it. Lots of people that aren't in the education world and understand how the timing of decisions work. It's really important with legislators that they understand that we can't wait until school starts to make some of these decisions. And also, we can't wait because even though we're talking about funding for the next school year, it's important that they understand actions and decisions right now are impacting the subsequent school year. So lots of legislators get confused about that. So anything superintendents can do to help with that messaging, of course, we will really appreciate it.
And the other frustration I know you're having is that, this is piecemeal. We weren't able to give you a guidance document on reopening school with all 16 of the guidance documents into a big volume back in May. It'd be great if we had all the vision to be able to do that. There's just no way. And so you're getting, the guidance documents every few weeks. That's not ideal, but that's the best we can do. The same with a lot of these waivers. This may not be the last time. It probably won't be the last time that either I sign another memo before I leave, or the new commissioner has to sign a memo giving more additional waiver authority or waiving things as these things come up, like the additional minutes in the day. Ideally, it'd be great if we had this and feedback, but some things we just don't know until we get on down the road in the process. And I know it's frustrating for you because you're down on the ground planning all this out for next year, but I just know that we recognize that it's frustrating.
Robin, I wanted to ask another question regarding care of preschool and the numbers for preschool, because we already know that those numbers are significantly down, just from conversations we've had with parents, and then I've got a broader question. But generally, the current year's preschool numbers that generates the funding, like SEC does for the following year. So I just bring that to the radar while we're looking at numbers, how that's done. And that may be included in the executive order. I don't know. So let me ask that question first.
So anything that has an ADA component, even if they are some of those LARS items, preschool being one of those, is included in the executive order.
Okay, perfect. Then a little different twist on this: the Healthy at School guidelines, are for K through 12. Pre-K is excluded, and I somewhat understand that because preschool is much more common based and private preschools, et cetera. But my issue, I guess we're trying to deal with internally, is there's kind of a different set of rules for preschool as it would be in an elementary school, K through 5. And I'm curious about that, if it's gotten lumped in with private preschool because by generic term, that's what it is in the Healthy School guidelines, or if there's any possibility we can consider our preschool students like we do our K through 5, so we don't have this disaggregation in the building of, that group of children. And I understand preschool is done very differently across the state. Ours are elementary school based, and so they are a vital component. They're considered, as part of the student population. at any one of our elementary schools. And so it creates a bit of a divide there because we're trying to follow the child care guidelines as opposed to the school guidelines for kids within that same building.
I'm going to take that one and let us talk with our public health professionals as well as internally. I can see, many times as guidance has been developed across the Commonwealth for different areas, sometimes I'll have to raise my hand and say, oh, don't forget, we have some of that in our schools. The example, I think one day that Dr. White and I were talking about was fishing tournaments. I think we were talking about fishing tournaments. And I said, oh my gosh, don't forget, we have some teams that are fishermen at our schools. So I think as we're rolling out the guidance, we have to remind ourselves how many things our public schools really touch. And so I think this is another good example where kind of preschool, some may think of that in a daycare capacity, and we think of it in our schools as an education component. So let us go back and look at those and see how different those that guidance is, and see if we can't come up with something that makes sense to still comply with the guidance that's been put out, but maybe we just need to tweak it a little bit for a school setting. Dr. White, do you have anything else to add?
This is Dr. Meserly. I do.
Okay.
I am actually, I'm on a call next week with Sarah Vanover and her team.
Oh, yeah.
She oversees, and I will bring that up with them if within that child care guidance, if we can possibly have some separate guidance that talks to the preschool level within the public school setting, to see if there's some things that we can tweak, and we can certainly make sure that that teachers or district level people are included in that.
Thank you.
Thank you, Dr. Meserly.
And did we cover the NTI part of that?
Yeah, there was, as part of the executive order, the memo that was written, the commissioner will be able to grant unlimited NTI days. Of course, that's a separate and apart from, and let me qualify that by saying, as long as we have an approved NTI plan by the commissioner here at KDE, and it's my understanding, I think Dr. Foster and David Cook may be on the call, but I think every school district has submitted an NTI plan.
Hey, Robin.
Yes.
This is David. Yes, and if you haven't received your actual letter back yet from me saying so, we've gone through, done all the review, and all the applications have been approved. So if you haven't seen something from me yet, just keep looking the next couple of days. But your NTI application has gone through the process. So everybody's going to be able to take advantage of those unlimited days.
Yep.
Can I ask you a question about that, Kevin, real quick?
Sure.
On NTI, because we talked about where we don't think there'd be wholesale school closures. So are we talking that a fourth grade class, if they were out for 15 days, we could put them on NTI and then they would be able to qualify for that attendance, correct?
Absolutely.
Okay, just want to make sure I was understanding that correctly.
The fourth grade, that example that we gave about the Callaway County fourth grade would apply. If you have 100 kids out of your 1,000 student district that mom or parent, guardian, grandma does not want to send the kids in just because of fear or because grandma has a medical condition, you can use NTI for them if you choose to educate them that way. If you have a alternative schedule because you want to increase social distancing and get more kids out of the building to spread them out more, and that means some classes come some days and not others, applies for that because you're going to educate those kids at home on the days they don't physically report. Any of those combinations works for that. Now, you still will have students on traditional home hospital instruction. And you would continue to do that as normal. That's a different analysis. That's a heightened standard. Obviously, you know how that works. This is for any child that decides for whatever reason, either district required or their own choice, to stay and be educated at home. And if you choose to provide that education that way, then we've got you covered with the funding, and there'll be no penalties as far as funding goes. There's no incentive or disincentive for you to do that. And you all started talking about educating kids this way. I mean, that was a great. I remember the first conversation I think I had with Superintendent LaFavors about that, and you all are doing that work and thinking outside the box, and you're to be commended for it. All right. Anything else? We have several things in the chat to draw your attention to. There is the exit form that was posted around 2/21, the exit slip. That does help us, and it does give us additional insight. And then a reminder, the next advisory council is July 20th. We're going to keep rolling with these every other week until you tell me enough is enough and we've got it. And that's not likely to happen anytime soon with the changing nature of this. And then I'm going to ask Karen to share a slide from KASS about the repository. I think you're all familiar with it, but in case you're not.
Yep, so I have it up here. And yeah, this is just a reminder, if you've been listening to the superintendent webcast, Jim was on there last week and shared this with us. So this is just a reminder that it's out there. This is where you can put, even if it's a draft document that you're working on for your reopening plan, he would like people to go ahead and start putting it out there. You'll also see that there's a naming convention that he'd like you to use, your district name, and then reopening plan FY21. And then there's some other reopening resource folder for information from other states or agencies that are out there as well. Thank you, Kevin.
Thank you. I want to thank everyone for all of the feedback today. It's very helpful. I mentioned that there's 3 items, the mandated test issue, the 24 or 72-hour issue, hotspot travel, and then the American Academy of Pediatrics report. We're going to be following up in the next 24 hours with our colleagues at Public Health, and hopefully to have some additional information on those items on tomorrow's webcast. Some communication feedback you all provided on promoting the why with masks and for children, and then also the positives of the virus, in that there are some things that parents and guardians can take a little bit of have a little bit of a positive note in sending their kids to school just because of the nature of the virus in children, making sure we are helping you all out in promoting that and getting that message out. And then when a school closes, another communication piece, communicating before that about how contact tracing works, but then also, most importantly, if we have to close part of a school or class, helping you all out with communication and talking points about how the other part of the school is safe during that quarantine, and then additional concerns regarding flexibility in the instructional hour, and how we may be able to give some additional minutes or restructure that temporarily for next year to allow for all the things that you're being asked to do for health, sanitation, and other reasons. So those are the major feedback and things that we owe you, and we appreciate it. Great meeting. The exit slip again is now in your chat at the last thing posted in your chat. Please fill that out. That does help us out. And we will see all of you tomorrow on the superintendent webcast.